Comprehensive Nursing Assistant Test Answers PDF Guide. Question 1. How should a fracture pan be positioned? Option A. With the handle toward the head of the bed. Option B. With the handle toward the foot of the bed. Option C. Sideways across the resident's hips. Option D. The handle should be removed before use. The correct answer is option B. With the handle toward the foot of the bed. A fracture pan is smaller and flatter than a standard bed pan. It should be placed with the flat end under the resident's buttocks and the handle toward the foot of the bed. Question 2. Where should the nursing assistant stand when helping a resident who is recovering from a stroke to walk? Option A. On the resident's stronger side. Option B. On the resident's weaker side. Option C. In front of the resident. Option D. Behind the resident. The correct answer is option B. On the resident's weaker side. Standing on the weaker side allows the NNAAP to provide support and stability to the side that is most likely to give way or cause a fall. Question 3. When a resident has left-sided weakness, which sleeve should be put on first when dressing? Option A. The right sleeve. Option B. The left sleeve. Option C. Both at the same time. Option D. The sleeve the NNAAP prefers. The correct answer is option B. The left sleeve. When dressing a resident with one-sided weakness, you always dress the weak, affected side first to make the process easier and more comfortable for the resident. Question 4. What should a nursing assistant observe and report regarding the musculoskeletal system? Option A. The resident's favorite type of exercise. Option B. White, shiny, red, or warm areas over a joint. Option C. The color of the resident's clothing. Option D. The resident's ability to remember their name. The correct answer is option B. White, shiny, red, or warm areas over a joint. Redness, warmth, or swelling over a joint are signs of inflammation or injury. These physical changes must be reported to the nurse to prevent further complications. Question 5. Which of the following is used when documenting the amount of fluid a resident drinks? Option A. Ounces. Option B. Pounds. Option C. Milliliters. Option D. Grams. The correct answer is option C. Milliliters. While fluid may be measured in ounces initially, it is standardized into milliliters, ml, in medical documentation to ensure accuracy and consistency across the care team. Question 6. When encountering a fire, a nursing assistant should first: Option A. Call the fire department. Option B. Extinguish the fire. Option C. Remove the resident from danger. Option D. Close all the windows. The correct answer is option C. Remove the resident from danger. Following the RACE acronym, rescue, alarm, contain, extinguish, the absolute first priority is to rescue anyone in immediate danger. Question 7. When communicating with a visually impaired resident, the nursing assistant should: Option A. Speak as loudly as possible. Option B. Avoid talking so the resident isn't confused. Option C. Tell the resident what the NNAAP is doing while providing care. Option D. Move the furniture around frequently. The correct answer is option C. Tell the resident what the NNAAP is doing while providing care. Since the resident cannot see what is happening, the NNAAP should use verbal cues and explain each step of the care process to provide comfort and reduce anxiety. Question 8. In order to communicate with a resident who is hearing impaired, the NNAAP should: Option A. Shout in the resident's ear. Option B. Face the resident directly when speaking. Option C. Avoid using any hand gestures. Option D. Speak to the resident from behind. The correct answer is option B. Face the resident directly when speaking. Facing the resident allows them to see your facial expressions and lips, which helps them understand the context and content of what you are saying. Question 9. If a resident with Alzheimer's disease shows violent behavior, the nursing assistant should: Option A. Hit the resident back. Option B. Restrain the resident immediately. Option C. Remove triggers that may be causing the behavior. Option D. Argue with the resident. The correct answer is option C. Remove triggers that may be causing the behavior. Violent behavior in dementia is often a reaction to a trigger, noise, pain, or frustration. Identifying and removing the trigger is the most effective way to calm the resident. Question 10. How should a resident with chronic obstructive pulmonary disease, COPD, be positioned? Option A. Lying flat on their back. Option B. Sitting upright. Option C. Lying on their stomach. Option D. Lying with feet elevated higher than the head. The correct answer is option B, sitting upright. Residents with COPD often have difficulty breathing. Sitting upright, Fowler's position, allows for better lung expansion and makes breathing easier. Question 11. Which of the following is true of transmission-based precautions? Option A. They are used instead of standard precautions. Option B. They are practiced in addition to standard precautions. Option C. They are only used for the elderly. Option D. They are used only when the NNAAP feels like it. The correct answer is option B. They are practiced in addition to standard precautions. Transmission-based precautions, contact, droplet, or airborne, are used when standard precautions alone are not enough to prevent the spread of a specific infectious disease. Question 12. A resident's protected health information, FI, may be shared with: Option A. Any employee of the facility. Option B. Only those who need the information for care or processing records. Option C. The resident's neighbors. Option D. The NNAAP's own friends. The correct answer is option B. Only those who need the information for care or processing records. HIPAA laws restrict the sharing of FI to a need-to-know basis. Only staff directly involved in the resident's medical or financial care should have access. Question 13. When providing perineal care for a female resident, the nursing assistant should: Option A. Wipe from back to front. Option B. Wipe from front to back. Option C. Wipe in a circular motion. Option D. Use the same area of the washcloth for every wipe. The correct answer is option B. Wipe from front to back. Wiping from front to back, cleanest to dirtiest, prevents the spread of bacteria from the anal area to the vagina or urethra, which could cause a UTI. Question 14. What is the medical term for high blood pressure? Option A. Hyperglycemia. Option B. Tachycardia. Option C. Hypertension. Option D. Hypotension. The correct answer is option C. Hypertension. Hypertension is the clinical term for blood pressure that is higher than the normal range. Hypotension refers to low blood pressure. Question 15. What is a good way for a nursing assistant to care for a mentally ill resident? Option A. Avoid talking to the resident. Option B. Support the resident and his or her family and friends. Option C. Correct the resident whenever they say something factually wrong. Option D. Encourage the resident to stop taking their medication. The correct answer is option B. Support the resident and his or her family and friends. Mental health care involves empathy and holistic support, and NNAAP should provide a supportive environment for the resident and their support system without judgment. Question 16. When should a nursing assistant identify a resident? Option A. After the resident has finished eating. Option B. Before helping with feeding. Option C. Only when the nurse is watching. Option D. Once a week. The correct answer is option B. Before helping with feeding. Identifying the resident immediately before providing care or food is essential to ensure that the right person receives the correct meal or treatment. Question 17. What thermometer is used to take a temperature from the ear? Option A. Oral thermometer. Option B. Axillary thermometer. Option C. Tympanic thermometer. Option D. Rectal thermometer. The correct answer is option C. Tympanic thermometer. A tympanic thermometer is a specialized device that measures the heat emitted from the eardrum, tympanic membrane. Question 18. For a nursing assistant, confidentiality means: Option A. Only telling the resident's roommates about their health. Option B. Keeping private things private. Option C. Sharing medical info with the NNAAP's own family. Option D. Writing about residents on social media. The correct answer is option B. Keeping private things private. Confidentiality is the legal and ethical obligation to keep a resident's personal and medical information private, sharing it only with the authorized care team. Question 19. Which sense is usually last to leave the body when a person is dying? Option A. Sight. Option B. Smell. Option C. Taste. Option D. Hearing. The correct answer is option D. Hearing. Hearing is believed to be the last sense to function as a person transitions toward death. Caregivers and families are encouraged to keep talking to their loved ones. Question 20. Nursing assistants do not usually perform procedures that require: Option A. Clean technique. Option B. Standard precautions. Option C. Sterile technique. Option D. Protective equipment. The correct answer is option C. Sterile technique. Sterile technique involves maintaining an environment free of all microorganisms. This is used in surgeries or complex wound care and is generally performed by licensed medical staff. Question 21. Where should the call light be placed when a nursing assistant leaves a resident's room? Option A. On the overbed table across the room. Option B. Within the resident's reach. Option C. In the bathroom. Option D. Attached to the doorway. The correct answer is option B. Within the resident's reach. The call light is the resident's lifeline. It must always be within their immediate reach so they can summon help without having to get up or struggle. Question 22. When assisting a patient with dentures, a nursing assistant should: Option A. Clean them in hot water. Option B. Store them in the resident's drawer without a container. Option C. Store them in a labeled denture cup with cool water. Option D. Tell the resident to sleep with them in. The correct answer is option C. Store them in a labeled denture cup with cool water. Dentures must be stored in water to prevent them from drying out and warping, and the cup must be labeled with the resident's name to prevent loss. Question 23. When assisting a resident with a standard bedpan, where should the wider end be placed? Option A. In alignment with the resident's buttocks. Option B. Toward the foot of the bed. Option C. Under the resident's knees. Option D. It does not matter which way it faces. The correct answer is option A. In alignment with the resident's buttocks. The wider, rounded end of a standard bedpan is designed to support the resident's buttocks and catch waste effectively. Question 24. Which temperature site is generally considered to be the most accurate? Option A. Oral. Option B. Axillary, armpit. Option C. Rectal. Option D. Tympanic, ear. The correct answer is option C. Rectal. Rectal temperatures are considered the most accurate because they measure internal body temperature directly. However, they are also the most invasive. Question 25. What is the correct conversion of 1900 hours to standard time? Option A. 7 a.m. Option B. 9 a.m. Option C. 7 p.m. Option D. 9 p.m. The correct answer is option C. 7 p.m. To convert military time from 1300 to 2400 to standard time, subtract 12 from the hour. 19 to 12 equals 7, which makes it 7 p.m. Question 26. What is a factor that may influence a resident's food preference? Option A. The NAA's favorite food. Option B. Religion. Option C. The time the NAA's shift ends. Option D. The weather outside. The correct answer is option B. Religion. Many religions have specific dietary laws, such as avoiding pork or beef. It is important to respect these beliefs when assisting with meals. Question 27. Standard precautions should be practiced. Option A. Only on residents with known infections. Option B. Only when blood is visible. Option C. On every single person in your care. Option D. Only in the isolation ward. The correct answer is option C. On every single person in your care. Standard precautions are the primary strategy for successful nosocomial infection control. They are based on the principle that all blood and body fluids are potentially infectious. Question 28. If a resident starts to fall, the best thing a nursing assistant can do is to: Option A. Try to catch the resident in her arms. Option B. Widen her stance and bring the resident's body close to her. Option C. Run and get a wheelchair. Option D. Tell the resident to stand up straight. The correct answer is option B. Widen her stance and bring the resident's body close to her. A NNAAP should not try to stop the fall, as this can injure both people. Instead, the NNAAP should widen their base of support and use their own body to ease the resident safely to the floor. Question 29. After an amputation, a resident may experience phantom sensation. Phantom sensation is: Option A. The belief that the limb will grow back. Option B. Pain or sensation caused by remaining nerve endings. Option C. A hallucination caused by medication. Option D. The ability to move the prosthetic limb with the mind. The correct answer is option B. Pain or sensation caused by remaining nerve endings. Phantom sensation or phantom limb pain occurs because the brain continues to receive signals from the nerve endings that used to supply the amputated limb. Question 30. A nursing assistant should wear gloves when: Option A. Brushing a resident's teeth. Option B. Giving perineal care to a resident. Option C. Helping a resident walk. Option D. Answering the resident's telephone. The correct answer is option B. Giving perineal care to a resident. Perineal care involve contact with mucous membranes and potential body fluids, urine or stool, making gloves a requirement for infection control. Question 31. What is one way a nursing assistant can promote a resident's independence? Option A, doing everything for the resident to save time. Option B, allowing a resident to do a task by himself no matter how long it takes. Option C, deciding what clothes the resident will wear every day. Option D, restricting the resident to their room. The correct answer is option B, allowing a resident to do a task by himself no matter how long it takes. Independence is vital for a resident's self-esteem, and NNAAP should encourage residents to do as much for themselves as possible, even if it takes longer than if the NNAAP did it. Question 32. Passive range of motion, PROM, exercises are done. Option A, by the resident without any help. Option B, when a resident cannot move on her own. Option C, only once a week. Option D, only after the resident has been discharged. The correct answer is option B, when a resident cannot move on her own. Passive ROM is performed by the caregiver for a resident who is unable to move their own joints. The caregiver moves the limb through the range of motion to maintain joint health. Question 33. Which is the most essential nutrient for life? Option A, carbohydrates. Option B, protein. Option C, water. Option D, vitamins. The correct answer is option C, water. The body can survive for several weeks without food but only a few days without water. Water is necessary for almost every bodily function, including waste removal and temperature regulation. Question 34. What is a type of advance directive? Option A, a birth certificate. Option B, durable power of attorney for healthcare. Option C, a resident's social security card. Option D, an employee handbook. The correct answer is option B, durable power of attorney for healthcare. A durable power of attorney for healthcare is a legal document that names a person to make medical decisions for someone if they become unable to do so themselves. Question 35. Restraints can be applied. Option A, whenever a resident is being difficult. Option B, only with a doctor's orders. Option C, if the NNAAP thinks the resident might fall. Option D, to prevent a resident from leaving the facility. The correct answer is option B, only with a doctor's orders. Restraints are a serious intervention that can lead to injury or psychological distress. They may only be used when medically necessary and must be ordered by a physician. Question 36. How can a nursing assistant help residents with their spiritual needs? Option A, encourage them to join the NNAAP's own religion. Option B, learn about the resident's beliefs and listen carefully. Option C, tell the resident that spiritual needs are not important. Option D, invite a priest even if the resident is not religious. The correct answer is option B, learn about the resident's beliefs and listen carefully. Spiritual care involves respecting the resident's individual beliefs. Listening and facilitating their access to their own religious practices helps meet these needs. Question 37. The first sign of skin breakdown is: Option A, a deep, open sore. Option B, pale, white, reddened, or purple skin. Option C, bleeding from the site. Option D, a visible bone. The correct answer is option B, pale, white, reddened, or purple skin. Skin breakdown starts with a change in color that does not go away when pressure is removed. Recognizing these early color changes can prevent a pressure sore from forming. Question 38. Joking with a resident's roommate about the resident's incontinence is what type of abuse? Option A, physical abuse. Option B, psychological abuse. Option C, sexual abuse. Option D, involuntary seclusion. The correct answer is option B, psychological abuse. Psychological, or mental, abuse involves causing emotional pain through insults, humiliation, or mockery, even if the resident is not directly addressed. Question 39. Diabetes can lead to which of the following complications? Option A, stronger eyesight. Option B, impaired wound healing. Option C, increased energy levels. Option D, improved circulation to the feet. The correct answer is option B, impaired wound healing. High blood sugar levels can damage blood vessels and nerves, leading to poor circulation and a weakened immune response, which makes it harder for the body to heal wounds. Question 40. What should a nursing assistant do each time a patient is repositioned? Option A, give the resident a snack. Option B, check the resident's skin. Option C, change the resident's clothing. Option D, perform a full bed bath. The correct answer is option B, check the resident's skin. Repositioning is the best time to inspect the skin for early signs of pressure sores, such as redness or paleness, especially over bony areas like the heels or tailbone. Question 41. What does palliative care involve? Option A, aggressive treatment to cure disease. Option B, pain relief and comfort. Option C, physical therapy to restore walking. Option D, assisting with financial and legal planning. The correct answer is option B, pain relief and comfort. Palliative care focuses on providing relief from the symptoms and stress of a serious illness. The goal is to improve quality of life for both the patient and the family. Question 42. Which of the following is a requirement of the Omnibus Budget Reconciliation Act, OBRA? Option A, NAS must have at least 50 hours of training. Option B, NAS must have at least 75 hours of training. Option C, NAS must be at least 21 years old. Option D, NAS must be able to prescribe medication. The correct answer is option B, NAS must have at least 75 hours of training. OBRA is a federal law that sets minimum standards for nursing assistant training. One requirement is that NAS must complete at least 75 hours of training and pass a competency evaluation. Question 43. When speaking with residents, nursing assistants should: Option A, use complex medical jargon. Option B, use simple, non-medical terms. Option C, talk to them like they are children. Option D, avoid eye contact. The correct answer is option B, use simple, non-medical terms. Using clear, everyday language ensures that the resident understands their care and can communicate their needs effectively. Question 44. Which position is a resident in if he is lying on his stomach? Option A, supine position. Option B, prone position. Option C, lateral position. Option D, Fowler's position. The correct answer is option B, prone position. The prone position is lying face down, supine is lying on the back, and lateral is lying on the side. Question 45. Which member of the care team diagnoses disease and prescribes treatment? Option A, nurse assistant. Option B, physician, MD. Option C, physical therapist. Option D, social worker. The correct answer is option B, physician, MD. The physician is responsible for the overall medical diagnosis and ordering the treatments and medications that the rest of the care team carries out. Question 46. Before helping a resident eat, how should the nursing assistant position the resident? Option A, lying flat on their back. Option B, lying on their side. Option C, sitting as upright as possible. Option D, in a semi-reclined position. The correct answer is option C, sitting as upright as possible. An upright position, 90 degrees, helps prevent choking and aspiration by allowing gravity to help move food down the esophagus correctly. Question 47. Insulin reaction, hypoglycemia, can be caused by: Option A, too much food. Option B, too little food. Option C, lack of exercise. Option D, high blood pressure. The correct answer is option B, too little food. An insulin reaction occurs when there is too much insulin and not enough glucose, sugar, in the blood. This often happens if a diabetic resident takes their insulin but skips a meal. Question 48. Generally, the last sense to leave a dying person is the sense of: Option A, sight. Option B, taste. Option C, smell. Option D, hearing. The correct answer is option D, hearing. Clinical observations suggest that hearing is the final sense to fail as the body shuts down during the dying process. Caregivers should continue to speak to the resident normally. Question 49. Which type of urine specimen does not include the first and last urine in the sample? Option A, routine urine specimen. Option B, clean catch, midstream. Option C, 24-hour urine specimen. Option D, catheterized specimen. The correct answer is option B, clean catch, midstream. A clean catch or midstream specimen involves cleaning the area, urinating a little, then catching the middle portion of the stream to ensure the sample is free of external bacteria. Question 50. What is the term for a device that replaces a missing body part? Option A, splint. Option B, prosthesis. Option C, cast. Option D, orthotic. The correct answer is option B, prosthesis. A prosthesis is an artificial device designed to replace a missing body part, such as a limb, tooth, or eye, to restore function or appearance. Question 51. What is the correct conversion of 4:10 p.m. to military time? Option A 0410 hours. Option B 1410 hours. Option C 1610 hours. Option D 2010 hours. The correct answer is option C, 1610 hours. To convert PM hours to military time, you add 12 to the hour, 4 plus 12 equals 16, resulting in 1610 hours. Question 52. What is considered a normal range for an adult's blood pressure? Option A 150/95, Option B 119/75, Option C 90/50ths, Option D 140/90. The correct answer is option B, 119/75. While blood pressure varies per individual, 119/75 mmHg is an example of a healthy, normal adult reading. Readings above 130/80 are often considered the start of hypertension. Question 53. How many rubber-tipped feet does a quad cane have? Option A, 1, Option B, 2, Option C, 3, Option D, 4. The correct answer is option D, 4. A quad cane has a 4-point base that provides more stability and support than a standard single-point cane. Question 54. In which of the following procedures must a nursing assistant always wear gloves? Option A, brushing a resident's hair. Option B, shaving a resident. Option C, taking a resident's pulse. Option D, feeding a resident. The correct answer is option B, shaving a resident. Shaving involves a risk of nicks or cuts, which could expose the gnaw to the resident's blood. Gloves are required per standard precautions. Question 55. Exercises that put each joint through its full arc of motion are called: Option A, aerobics. Option B, range of motion. Option C, weightlifting. Option D, cardiovascular training. The correct answer is option B, range of motion. Range of motion, ROM, exercises are specifically designed to move each joint through its full functional arc to maintain flexibility and prevent muscle atrophy or contractures. Question 56. When observing catheters, a nursing assistant should be sure that: Option A, the bag is hanging on the bed rail. Option B, the drainage bag is kept lower than the hips or bladder. Option C, the tubing has many loops to catch the urine. Option D, the bag is touching the floor. The correct answer is option B, the drainage bag is kept lower than the hips or bladder. Keeping the bag below the level of the bladder uses gravity to ensure urine drains properly and prevents the backflow of contaminated urine into the bladder. Question 57. Which of the following abbreviations means nothing by mouth? Option A, NBM, Option B, NPO, Option C, BM, Option D, P. The correct answer is option B, NPO. NPO is the medical abbreviation for nil per os, which is Latin for nothing by mouth. It is used when a patient cannot have food or fluids by mouth. Question 58. When using a transfer belt, the NNAAP should: Option A, place it underneath the resident's clothing. Option B, place it over the resident's clothing. Option C, tighten it until the resident cannot breathe. Option D, use it only for residents who can walk perfectly. The correct answer is option B, place it over the resident's clothing. The transfer belt, or gait belt, should be placed over clothing to protect the resident's skin from friction or pinching while providing the NNAAP a secure place to hold. Question 59. A way to prevent aspiration during oral care of unconscious residents includes: Option A, using plenty of toothpaste and water. Option B, positioning the resident on their back. Option C, using as little liquid as possible. Option D, giving the resident a glass of water to rinse. The correct answer is option C, using as little liquid as possible. Unconscious residents cannot swallow and are at high risk for aspiration, fluid entering the lungs. Caregivers should use minimal fluid and keep the resident on their side during oral care. Question 60. What member of the care team helps a resident learn to use adaptive devices for eating or dressing? Option A, speech-language pathologist. Option B, occupational therapist. Option C, registered dietitian. Option D, activities director. The correct answer is option B, occupational therapist. Occupational therapists, OTS, focus on helping residents perform activities of daily living, ADLS. This often involves training residents to use adaptive tools like weighted spoons or reachers. Question 61. If an activity is not listed on the care plan, what is the responsibility of a nursing assistant? Option A, perform the activity if the resident asks. Option B, the NNAAP should not perform the activity if it is not listed. Option C, ask the resident's family if it is okay. Option D, perform the activity but do not document it. The correct answer is option B. The NNAAP should not perform the activity if it is not listed. The care plan is a legal document and a specific set of instructions for a resident's care, and NNAAP must only perform tasks that have been approved and listed by the supervising nurse. Question 62. Which of the following healthcare settings is for people who have approximately 6 months or less to live? Option A, long-term care facility. Option B, acute care hospital. Option C, hospice. Option D, assisted living. The correct answer is option C, hospice. Hospice care focuses on the palliation of a chronically ill, terminally ill, or seriously ill patient's pain and symptoms, and attending to their emotional and spiritual needs at the end of life. Question 63. What is a good way for a nursing assistant to respond to inappropriate sexual behavior by a resident? Option A, scold the resident in front of others. Option B, ignore the behavior and walk away. Option C, take the resident to a private area. Option D, call the resident's family to complain. The correct answer is option C, take the resident to a private area. Residents may exhibit inappropriate behavior due to confusion or dementia. The NNAAP should remain professional, stay calm, and move the resident to a private area to maintain their dignity. Question 64. During a seizure, a nursing assistant should: Option A, put something in the resident's mouth to prevent tongue biting. Option B, restrain the resident's movements. Option C, keep the resident safe and protect their head. Option D, run out of the room to find help. The correct answer is option C, keep the resident safe and protect their head. The priority during a seizure is to prevent injury. Clear away furniture, place something soft under the head, and never put anything in their mouth or try to hold them down. Question 65. What is a task that is outside the scope of practice for a nursing assistant? NNAAP. Option A, measuring vital signs. Option B, helping a resident get dressed. Option C, inserting tubes into a resident's body. Option D, ambulating a resident with a walker. The correct answer is option C, inserting tubes into a resident's body. Nursing assistants are not permitted to perform invasive procedures. Inserting tubes, such as catheters or feeding tubes, requires the clinical training of a licensed nurse or physician. Question 66. Which kind of care helps restore a resident to the highest level of functioning possible? Option A, hospice care. Option B, palliative care. Option C, rehabilitation. Option D, acute care. The correct answer is option C, rehabilitation. Rehabilitation involves a set of interventions designed to optimize functioning and reduce disability in individuals with health conditions in interaction with their environment. Question 67. HIV can be transmitted. Option A, by hugging an infected person. Option B, to a fetus by an infected mother. Option C, through the air when someone coughs. Option D, by sharing a water glass. The correct answer is option B, to a fetus by an infected mother. HIV is transmitted through blood, semen, vaginal fluids, and breast milk. It can be passed from a mother to her child during pregnancy, childbirth, or breastfeeding. Question 68. Maintaining equal intake and output is known as: Option A, metabolism. Option B, fluid balance. Option C, homeostasis. Option D, circulation. The correct answer is option B, fluid balance. Fluid balance occurs when the amount of fluid taken into the body is roughly equal to the amount of fluid lost through urine, sweat, and breath. Question 69. To treat a minor burn, a nursing assistant should: Option A, apply butter or oil to the area. Option B, use cool, clean water. Option C, apply a tight bandage. Option D, use ice cubes directly on the skin. The correct answer is option B, use cool, clean water. Cool water helps decrease the temperature of the skin and stops the burning process. Butter or oil can trap heat and increase the risk of infection. Ice can cause further tissue damage. Question 70. If a nursing assistant sees a letter for the resident at the front desk, she should: Option A, open it for the resident. Option B, take the letter to the resident's room unopened. Option C, read the letter to other staff members. Option D, leave it at the desk. The correct answer is option B, take the letter to the resident's room unopened. Residents have a legal right to privacy, which includes the right to receive unopened mail, and NNAAP should ensure the mail reaches the resident privately. Question 71. When leaving a resident's room, a nursing assistant should: Option A, leave the bed in its highest position. Option B, turn off all the lights, even if the resident is reading. Option C, restock supplies and leave the call light within reach. Option D, take the resident's water pitcher with them. The correct answer is option C, restock supplies and leave the call light within reach. Ensuring the room is stocked and the call light is within the resident's reach are essential safety steps that allow the resident to call for help if needed. Question 72. 10 ounces is equal to blank milliliters, ml. Option A, 30. Option B, 100. Option C, 300. Option D, 500. The correct answer is option C, 300. Since 1 ounce equals 30 ml, you multiply 10 by 30 to get 300 ml. Question 73. If a resident with Alzheimer's disease has problems with dressing, the nursing assistant should: Option A, choose the outfit for them to save time. Option B, lay out clothes in the order they should be put on. Option C, tell the resident to hurry up. Option D, dress the resident without saying anything. The correct answer is option B, lay out clothes in the order they should be put on. Providing structure and simplifying the task helps a resident with dementia remain independent. Laying clothes out in sequence reduces confusion. Question 74. What is an example of a common cliché that should be avoided when communicating? Option A, I understand how you feel. Option B, it will all work out in the end. Option C, can you tell me more about that? Option D, I will be back in 10 minutes. The correct answer is option B, it will all work out in the end. Clichés are overused expressions that can seem dismissive. Telling a resident, it will all work out, minimizes their feelings and can shut down meaningful communication. Question 75. Which attitude is helpful when working in hospice? Option A, encourage the resident to fight the disease. Option B, respect the resident's privacy and independence. Option C, avoid the resident's room as much as possible. Option D, talk loudly so the resident knows you are there. The correct answer is option B, respect the resident's privacy and independence. Hospice workers should provide a calm, respectful presence, honoring the resident's wishes and maintaining their dignity during their final days. Question 76. How can a nursing assistant assist residents with normal changes of aging related to the urinary system? Option A, restrict fluids so the resident urinated less. Option B, offer frequent trips to the bathroom. Option C, suggest the resident use a catheter instead. Option D, tell the resident to hold their urine longer to strengthen the bladder. The correct answer is option B, offer frequent trips to the bathroom. Aging can lead to a decreased bladder capacity and weakened muscles. Offering frequent toileting helps prevent accidents, incontinence, and promotes resident dignity. Question 77. What is a function of the nervous system? Option A, provides a framework for the body. Option B, senses and interprets information from outside the body. Option C, pumps blood to the various parts of the body. Option D, removes waste from the blood. The correct answer is option B, senses and interprets information from outside the body. The nervous system, the brain, spinal cord, and nerves, acts as the body's control center, processing sensory input and coordinating the body's responses. Question 78. With whom may a nursing assistant share a resident's medical information? Option A, the resident's best friend. Option B, other staff members involved in the resident's care. Option C, the NNAAP's own family. Option D, anyone who asks. The correct answer is option B, other staff members involved in the resident's care. Under HIPAA, medical information is confidential and should only be discussed with the healthcare team members who need that information to provide care. Question 79. What is one important reason why the bed should remain wrinkle-free? Option A, to keep the room looking tidy. Option B, to prevent the resident from rolling out. Option C, to help keep the skin healthy and prevent pressure sores. Option D, to make it easier for the nurse to change the linens. The correct answer is option C, To help keep the skin healthy and prevent pressure sores. Wrinkles in bed linens create friction and uneven pressure points on a resident's skin. This can lead to skin breakdown and the development of pressure sores, decubitus ulcers. Question 80. Pressure sores can lead to: Option A, improved skin elasticity. Option B, life-threatening infections. Option C, better circulation. Option D, faster wound healing. The correct answer is option B, life-threatening infections. If left untreated, pressure sores can become deep, infected, and lead to sepsis, a blood infection, or bone infections, which can be fatal. Question 81. Incontinence may be caused by: Option A, eating too much fiber. Option B, nervous system diseases. Option C, lack of exercise. Option D, drinking too much water. The correct answer is option B, nervous system diseases. Incontinence, the loss of bladder or bowel control, is often a symptom of underlying medical issues, such as nervous system disorders that affect the signals between the brain and the bladder. Question 82. What can nursing assistants do in regards to IVs? Option A, start the 4 line. Option B, adjust the flow rate of the 4. Option C, observe the 4 site for problems and report them. Option D, change the 4 fluid bag when it is empty. The correct answer is option C, observe the 4 site for problems and report them. NAS are not allowed to manage or alter IV therapy. Their role is limited to observing the site for redness, swelling, or leaking and reporting those findings to a nurse. Question 83. The ability to think logically and quickly is called: Option A, intelligence. Option B, cognition. Option C, memory. Option D, intuition. The correct answer is option B, cognition. Cognition refers to the mental processes of acquiring knowledge and understanding through thought, experience, and the senses. Question 84. Providing privacy while giving care is a patient's: Option A, professional courtesy. Option B, legal right. Option C, optional choice. Option D, facility preference. The correct answer is option B, legal right. The right to privacy and confidentiality is a core legal right of every resident under the Residents' Bill of Rights and OBRA regulations. Question 85. A blank is the permanent and painful stiffening of a joint and muscle. Option A, sprain. Option B, contracture. Option C, fracture. Option D, dislocation. The correct answer is option B, contracture. A contracture occurs when a lack of joint movement causes the muscle to shorten and stiffen permanently, often freezing the joint in a flexed position. Question 86. What should a nursing assistant do if she suspects a resident is being abused? Option A, wait for more evidence before acting. Option B, ask the resident if they are being abused. Option C, report it to the nurse immediately. Option D, call the police herself before telling the nurse. The correct answer is option C, report it to the nurse immediately. NAS are mandated reporters. Any suspicion of abuse must be reported to the supervising nurse immediately so that the facility can follow legal protocols for investigation and protection. Question 87. What is an example of a normal change of aging? Option A, inability to think clearly. Option B, weaker muscles. Option C, constant pain. Option D, complete loss of vision. The correct answer is option B, weaker muscles. While diseases can cause severe symptoms, the gradual weakening of muscles is a normal, physiological part of the aging process. Question 88. When should sheets be changed? Option A, once every 7 days. Option B, only when a new resident is admitted. Option C, whenever they are soiled, wrinkled, or damp. Option D, every morning regardless of condition. The correct answer is option C, whenever they are soiled, wrinkled, or damp. To prevent skin breakdown and maintain hygiene, linens must be changed immediately if they become wet, dirty, or wrinkled. Damp or soiled sheets are a primary cause of skin irritation. Question 89. What does the chain of command do? Option A, lists the residents in order of their needs. Option B, describes the line of authority in a facility. Option C, describes the physical layout of the building. Option D, lists the medications a resident must take. The correct answer is option B, describes the line of authority in a facility. The chain of command is the organizational structure that identifies who is in charge and whom each employee should report to. This ensures clear communication and accountability. Question 90. Standing with the legs shoulder width apart is an example of using Option A, low center of gravity. Option B, good body mechanics. Option C, mechanical advantage. Option D, isometric exercise. The correct answer is option B, good body mechanics. Good body mechanics involves using the body in an efficient and careful way. A wide base of support, feet shoulder width apart, provides better balance and stability when lifting or moving patients. Question 91. To prevent falls, a nursing assistant should: Option A, keep walkways free of clutter. Option B, tell residents to stay in their beds. Option C, wax the floors until they are very shiny. Option D, keep the room lights off. The correct answer is option A, keep walkways free of clutter. Keeping paths clear of objects, rugs, or spills is a primary way to reduce the risk of trips and falls in a healthcare facility. Question 92. Which is true about nursing assistants and catheters? Option A, NAS insert the catheters. Option B, NAS irrigate the catheters. Option C, NAS observe and report regarding the catheter and drainage. Option D, NAS decide when the catheter should be removed. The correct answer is option C, NAS observe and report regarding the catheter and drainage. NAS are responsible for catheter care, cleaning the site, and observing the tubing and urine for any abnormalities, then reporting them to the nurse. Question 93. What is an overbed table primarily used for? Option A, storage of soiled linens. Option B, placement of meals. Option C, a seat for visitors. Option D, a place for the not to write reports. The correct answer is option B, placement of meals. Overbed tables are designed to slide over the bed or chair to provide a clean surface for residents to eat, write, or perform personal grooming. Question 94. The artificial opening in the abdomen of a resident with an ostomy is called a: Option A, stoma. Option B, suture. Option C, incision. Option D, valve. The correct answer is option A, stoma. A stoma is the surgically created opening on the surface of the abdomen through which waste is diverted into an ostomy bag. Question 95. What is an example of physical abuse? Option A, ignoring a resident's call light. Option B, pinching a resident. Option C, telling a resident they are stupid. Option D, stealing a resident's money. The correct answer is option B, pinching a resident. Physical abuse is any intentional act causing physical injury or trauma to another person. Pinching, hitting, or slapping are all forms of physical abuse. Question 96. To convert 4 ounces of water to milliliters, ml, the nursing assistant should multiply 4 by: Option A, 10, Option B, 30, Option C, 50, Option D, 100. The correct answer is option B, 30. In healthcare, 1 ounce is approximately equal to 30 milliliters, ml. Therefore, to find the ml in 4 ounces, you multiply 4 by 30 to get 120 ml. Question 97. What is a guideline for good skin care? Option A, apply alcohol to dry areas. Option B, rub reddened areas vigorously. Option C, check the resident's skin daily and report changes. Option D, bathe the resident in hot water daily. The correct answer is option C, check the resident's skin daily and report changes. Daily inspection is key to preventing skin breakdown. Reddened areas should never be rubbed, as this can damage the fragile tissue further. Question 98. Why should a NNAAP be concerned if they notice a resident's skin has become pale, white, or reddened? Option A, it means the resident is getting too much sleep. Option B, it could be the beginning of a pressure sore. Option C, it indicates the resident is about to have a seizure. Option D, it shows the resident is finally getting enough water. The correct answer is option B, it could be the beginning of a pressure sore. These color changes indicate that blood flow to the area is being restricted. If the pressure isn't relieved, the tissue will die, resulting in a pressure sore. Question 99. Which of the following statements is true of pain? Option A, everyone feels pain the same way. Option B, pain is a different experience for each person. Option C, if a resident doesn't complain, they aren't in pain. Option D, older people don't feel pain as much as younger people. The correct answer is option B, pain is a different experience for each person. Pain is subjective. What one person considers minor, another may find excruciating. And NNAAP must always believe a resident's report of pain. Question 100. The single most important thing you can do to prevent the spread of disease is to: Option A, wear a mask at all times. Option B, wash your hands. Option C, keep the facility windows closed. Option D, use a lot of perfume. The correct answer is option B, wash your hands. Hand washing is the most effective way to remove pathogens and prevent the cross-contamination of germs between residents and staff.